We have to remember PCOS is a lifelong condition. We cannot be telling people with PCOS, you can never have sugar, you can never have carbs, you can never have birthday cake, you can never have pizza. This is not realistic. And it's actually cruel to tell someone that they have to change their diet for their lifetime because they're diagnosed with this condition.
Are you ready to transform the way you communicate about nutrition with your patients? Welcome to Exam Room Nutrition, the podcast where the worlds of nutrition, medicine, and communication collide. Whether you're a seasoned physician or a healthcare student, this podcast is for you. So stick around and let's make our patients healthier, one exam room at a time.
Welcome back to the Exam Room Nutrition Podcast. I'm your host, Colleen Sloan. I'm a registered dietitian and pediatric PA. According to the Endocrine Society, PCOS affects 7 to 10% of women of childbearing age and is the most common cause of infertility. In the United States, an estimated 5 to 6 million women have PCOS. So by the end of the show today, you'll be equipped with the answers to the next time your patient asks you, I have PCOS. What foods should I eat? To help us navigate the world of PCOS, Melissa Groves Azzaro is joining us. She's a registered dietitian, CEO, and founder of the Hormone Dietitian. She's an integrative dietitian empowering women to conquer hormone imbalances, PCOS, and fertility challenges. I am truly in awe of her because she is a woman of all trades. She is an author as well. She wrote a book called A Balanced Approach to PCOS, and she also hosts her own captivating podcast called Hormonally Yours with the Hormone Dietitian. You can also follow her on Instagram at the Hormone Dietitian. Melissa, welcome to the show.
Thank you so much for having me.
Let's debunk some myths about diet and PCOS. So, is there a specific PCOS diet that these patients need to be following?
No, there is not a specific quote unquote PCOS diet. So part of the problem is that every case of PCOS is different. It's a syndrome. So it is a spectrum of symptoms and root causes and metabolic differences. So every single person is going to present differently. Some people are more metabolic, where it's linked to insulin resistance, diabetes, heart disease. Others are more reproductive, and weight isn't necessarily an issue for them. So there's never going to be a single quote unquote PCOS diet that works for all people who are diagnosed with the condition. So as far as general guidelines, there really aren't any. The most common recommendation, the expert international guidelines recommend a 5 to 10% loss in body weight and say that improves symptoms and markers. But I always ask, was it the weight loss itself, or was it the behaviors that led to the weight loss, like eating more vegetables, getting more exercise, decreasing junk food consumption, that led to the improvements? And I tend to think it's the latter.
Very interesting. And thank you for clarifying that, because we see a lot out there that talks about, special diets for PCOS. Are there specific foods or like food groups that should be emphasized or maybe avoided in a PCOS friendly diet?
Yeah, so I always want to go back to the research. What do we know? Despite what you might read on social media, there is literally no, as in zero studies on PCOS and gluten. There's no research that any food has to be completely eliminated for a PCOS-friendly diet. There's one study on PCOS and dairy, and it was in combination with a low-carb approach. So no studies out there saying you have to avoid X food for PCOS. That being said, there are some studies that, we can get some key takeaways from. There are a few studies showing that a moderate carb approach, it's called low carb in the title, but when it says low carb in the headline, but then you actually read the study, it's actually 40% of daily calories. So around 40%, which I consider a much more moderate carb approach, definitely lower than the standard American diet. But there's research that a moderate carb approach can impact insulin levels, weight, testosterone, et cetera. These are all good things when it comes to PCOS. We know that low glycemic foods are better for PCOS than the higher glycemic foods. So we want to focus on the quality of the carbs we're eating. So whole foods, legumes, whole grains, fruits, vegetables, that seems to make a difference. A higher protein approach than typically recommended helps balance blood sugar, reduce cravings, not only help with weight loss, but ensure that the weight being lost is fat and not lean body mass. So 25 to 35% of daily calories from protein, which is more that upper end of the acceptable macronutrient distribution range, but that seems to help. Fats. We love fats because fats don't impact blood sugar or insulin at all. So a moderate fat approach also helps, focusing on those healthy fats like avocados, olive oil, nuts, seeds, and omega-3s found in fatty fish, which can not only help lower inflammation, but also help lower testosterone levels. High consumption of high antioxidant fruits and vegetables to lower oxidative stress and inflammation and contribute fiber to the diet. High fiber approach is also useful because it improves digestion, lowers hormone levels, and weight. I tend to recommend at least 30 grams of fiber a day for most people with PCOS. So basically what I end up recommending is a pretty balanced macro, mostly whole foods, Mediterranean style diet. And when it comes to what to minimize, ultra processed foods, excess sugar, I use the WHO guidelines. WHO recommends no more than 5% of daily calories come from added sugar. That works out to around 20, 25 grams a day for most people. All those artificial things, artificial sweeteners, flavors, colors, fried foods. I never say eliminate because we don't need to avoid these foods entirely, but I do think, most people know that foods like potato chips and French fries aren't necessarily supportive of health, PCOS or not. So we just need to be mindful and consume them infrequently and mindfully.
So it sounds like it's an all foods fit kind of module and trying to just eat generally healthy most of the time. Definitely doesn't sound like a fad diet that I've seen, promoted on social media. Now let's talk to the clinicians who are listening. So I have a patient who came to me in clinic. Maybe they were newly diagnosed and they say, I have PCOS. What foods can I eat? Can you give us some verbiage or some specific things that the clinician can say to that patient to at least get them started so they're not feeling overwhelmed, but would get them on the right track towards healthful eating?
Yeah, I would say the biggest thing that I see as a dietitian working exclusively with people with PCOS is that their doctors are telling them to lose weight. They're telling them to eat less and move more, but they're almost never asking them what they're actually eating and how much they're actually moving. Some of these women, because they've been on diets all their life, they're eating like 1,200, 1,100 calories a day already. So telling them to eat less is not the answer. So you want to listen to your patients. You want to ask them what they're actually doing, what their dieting history is, what's working for them, what's not working for them. Refer them to a registered dietitian for specifics. I see a lot of times doctors are, on their own health journeys, and you may be super excited about intermittent fasting or keto or paleo or whatever you're doing, but that doesn't make it appropriate for a person with PCOS. So, I always want you to work with the patient where they're at. And the fact that you work with pediatrics, I've worked with some teens and, they are eating more processed foods. They're eating more fast food with their friends. A lot of them don't have very broad diets when it comes to the types of fruits and vegetables they're willing to eat. So really the referral to a registered dietitian who can help them with the specifics is going to be key.
Now, you mentioned a little bit about some weight loss. That is a goal and that can be very, very helpful. But let's dig into that a little bit more. How important is it for these patients to lose weight?
Yeah, so we're always thinking about correlation and causation, right? So there's some research that losing weight improves certain markers in PCOS, improves certain symptoms. There was a study that showed that delaying fertility treatment in favor of implementing nutrition and lifestyle changes first actually resulted in higher ovulation rates and higher pregnancy rates. So, focusing on nutrition and lifestyle is important. We know that even a small weight loss, so 5% of weight. So when we're talking about someone who's 200 pounds, that can be as little as 5 pounds weight loss, 10 pounds weight loss. It's not a huge amount, but we know that that's associated with better blood sugar control, lower androgens, and more regular cycles. However, weight is not a behavior. So it's the behaviors and the habits that lead to weight loss that make a difference. So things like walking more, eating more fruits and vegetables, focusing on protein, getting enough sleep, lowering stress levels. So in my opinion, weight matters, but we can't focus only on weight because it's actually impossible to lose weight if you have insulin resistance, inflammation, high androgens, microbiome disturbances, all of the things that come along with PCOS. So we need to focus on those upstream root causes, not on the weight and the scale itself. So, another thing that we like to think about is if weight were the answer, if losing weight helped PCOS, explain lean PCOS. These are people who are normal weight, who have all of the signs and symptoms of PCOS and a confirmed diagnosis. Or, I've worked with dozens of women who were told bariatric surgery, you're going to lose the weight. And they had the surgery, they lost over 100 pounds, and they're coming to me 2-3 years after surgery because they still have all of the symptoms they were dealing with before the surgery. The irregular cycles, the hair loss, the acne, all of the things that were bothering them before. So weight is associated with some of these things, but losing weight is not a treatment for PCOS.
Thank you so much for clarifying that, because I think so often we as clinicians are so focused on, okay, you got to lose weight, you got to lose weight. And then you're right. The patients hear that, okay, I'm going to lose weight. And maybe they do, and they're successful, but they haven't solved their PCOS or they haven't solved the infertility issues. And I can imagine that must be so disheartening for them as a patient. Now, along those lines, we've talked a little bit about weight loss. Are there specific foods? I know just general fruits and vegetables, more of a Mediterranean diet, but give us a little bit more detail on kind of what that looks like, maybe what the patients could possibly be eating for breakfast, lunch, or dinner, so that the clinician listening to this might be able to give some real life suggestions to their patients.
Yeah, high protein, high fiber. So, I like to tell them to aim for 30 to 45 grams of protein per meal. So breakfast, lunch, and dinner. For reference, one egg has 6 grams of protein. So 2 eggs is not going to get you there. So, we're doing things like smoothies with protein powder. We're doing eggs with vegetable scramble. We're doing, some maybe turkey sausage on the side. Lunches, we're doing, I love a salad for lunch because you can throw so much in there. Big salad with a big piece of protein, some avocado, some nuts, all of the colors. I like to tell them to recommend 2 colors on their plate per meal. So let's say you're having spinach and egg scramble for breakfast. Add some berries to that, and now you've got purple and green on your plate. So, those are kind of concrete recommendations we can make.
I actually love that, the 2 colors on the plate. That's a really easy thing to suggest that the patient can do. And I know for me, getting protein in at breakfast is really hard, right? Because if you don't like eggs, or you're trying to avoid, sausage or meat or anything like that, breakfast can be really challenging. So I like the smoothie with the protein powder. Really good suggestion there. Now, talking about protein powder, let's jump over to any nutritional supplements or even herbal remedies that we should consider recommending, in addition, like complementing dietary interventions.
Yeah. So, 75 to 95% of people with PCOS have some degree of insulin resistance. So I consider inositol to be foundational for PCOS, and actually the international expert guidelines have included it in their publications. They're starting to see these sort of natural additions to medications and nutrition and lifestyle. So inositol is a wonderful addition for most people with PCOS. I always tell my patients, we're going to treat you like you're insulin resistant until we prove otherwise, because so many of them are. Beyond that, vitamin D, vast majority of people are deficient in vitamin D, and it helps support blood sugar and ovulation. Fish oil is another one. Most people are not eating the recommended amounts of fish during the week. Fish oil can not only help lower inflammation, but also help lower testosterone. So super helpful. Probiotic, there's more and more research on supporting PCOS with probiotics, because that supports gut health, and your microbiome can help support your metabolism. Fiber supplements, if they're having trouble meeting fiber targets, there's no shame in recommending a little bit of fiber supplementation throughout the day. Multivitamin, especially if they're on medications that can deplete nutrients like the pill or metformin or, the new GLP-1 weight loss meds. Beyond that, there are many supplements that can help with PCOS. I don't recommend anything sort of beyond the ones I talked about without having done comprehensive testing on them to see what they need and don't need.
I want to stay on the topic of supplements. If we as clinicians say, hey, maybe you should take a vitamin D, a fish oil supplement, would telling our patients to just pick one up off of, let's just say, the pharmacy or the over-the-counter shelf, are those appropriate? Would those be safe? Or do you suggest they purchase elsewhere? And maybe what specifically on the label should they be looking for?
Yeah, I'm very particular when it comes to fish oil. I don't know about you, but I've definitely had patients who come to me and say, I tried fish oil. It gave me the fish burps. You want a high quality fish oil. So, I'm looking for professional grade, third-party certifications, things like that. There are really only a couple of fish oil brands that I trust. Multivitamin, it depends. I feel like some of the drugstore brands have gotten better. Vitamin D, kind of same thing. I do recommend vitamin D in combination with K2 if we're doing anything over 1,000 milligrams a day. So really, it's kind of a toss-up. Like some things, fine, get it from the drugstore. Other things, you definitely want to pay more attention. I do know there are a ton of inositol supplements on Amazon. I really recommend working with the sort of professional supplement company brands to ensure quality, look for third-party testing to make sure it contains what it says it contains. There's a lot of supplements marketed to people with PCOS because it is a very vulnerable population. So there are a ton of, PCOS hormone balancing supplements or fertility boosting supplements that I would not trust.
Yeah, I know some people are leery on one hand of trying supplements because, you never know what you're getting in it. But I love that you made that point to make sure it's third party tested, really, really high quality. And then you do have the other people who are so desperate, and my heart goes out to them, who are so desperate to, have children that they spend tons of money on these supplements. And like you said, they're really just taking their money and they're not really beneficial and they're not evidence-based or scientifically backed at all. So thank you for clarifying that. Now let's again talk to the clinicians on how can we maybe give some suggestions or some guidance in helping these patients struggling with PCOS when they are struggling with cravings or emotional eating, because I know that's a big factor when you are trying to just eat healthfully. Do you have any tricks of the trade that we might be able to relay to our patients regarding those things?
It's important to remember that people with PCOS have been told all their life they need to lose weight. They've been on diets, some of them for decades, just diet after diet after diet. They struggle with body image issues. Mental health issues are much higher in the PCOS population. So depression and anxiety, 3 to 4 times higher risk for eating disorders, particularly binge eating disorder. So sometimes it's not about the food at all. right? It's not about they don't have willpower or they just can't stick to a plan. They actually could benefit from a referral to a licensed mental health counselor who can help them identify what are those emotional triggers and help them build a toolbox of coping skills that don't involve food. So if someone's, sort of repeatedly not sticking to a diet, consider that. That being said, there are physiological reasons why some of this can be happening. So insulin resistance itself increases cravings for carbs and sugar because the sugar is stuck in the bloodstream and can't get into the cells. So the cells are literally sending signals to the brain, you need carbs, you need sugar. So that's really hard to fight when you've got this sort of physiological drive to eat these things. Another really common pattern I see is that we start off the day trying to be good. We might skip breakfast. We might eat just a salad for lunch, and we're under eating throughout the day. So then at night, we end up overeating and not really having control and binging. So we're in a much better place at night to make good decisions about what we're going to eat next if we're properly fueling ourselves throughout the day. So that's probably one of the bigger ones. In terms of social situations, and this is another big one. We have to remember PCOS is a lifelong condition. We cannot be telling people with PCOS, you can never have sugar, you can never have carbs, you can never have birthday cake, you can never have pizza, you can never go on vacation and have ice cream with your family. This is not realistic. And it's actually cruel to tell someone that they have to change their diet for their lifetime because they're diagnosed with this condition. So foods like that are a normal part of life. Any diet changes that we make have to be something that someone can stick with for a lifetime. So eat more fruit as opposed to never eat pizza again, because PCOS is a lifelong condition. So, it's really not about being perfect all day, every day. It's about the things that we're doing the majority of the time and not sweating the small stuff.
Super, super helpful. I am with you on I hate the you can never have, putting a list of these are off limits foods because it's the first foods you want to have. And, if we are struggling with a mental health disorder and disordered eating, now, making them restrict from some foods that can be so enjoyable, especially during holidays and special occasions, that's just so detrimental, I think, to their mental and physical well-being. So I love that you had mentioned that we can encourage them, that they can still have pizza, some cake, because like you said, it's real life. That's reality. So I wonder if you can give us, as a clinician, what types of questions might we ask a patient to draw out or find out if they are struggling with food cravings or emotional eating? Because if we don't ask, we might not know. So are there certain things that we could say as a clinician to ask the patient to maybe draw those things out of them?
Yeah, I'm usually walking them through a typical day. I want to know what time they're waking up, what they're eating, what they're drinking, what they're doing in between meals, what time of day they work out, if they're working out, whether they're working from home or going to the office, because so many people are working from home now. I do ask on my intake form to sort of go through a checklist of factors, things like emotional eating or binge eating. I ask them specifically, are you eating anything after dinner? And if so, what? Because those kind of things can typically, bring up some of these emotional eating sort of red flag areas. Usually it's after work or after dinner. That's normally when most of this is happening. If they say yes to any of those, I like to ask them if they've identified which emotions are most tied to them eating food. I would say, for most of them, stress, feeling lonely, feeling bored. These are all emotions that can be tied to eating. Then I like to ask them if they could figure out what a more appropriate response to that emotion would be. If you're lonely, could you call a friend? Could you, text a friend? What can you do to address the emotion you're having? Because food isn't the answer to that emotion. So really kind of diving into what their daily habits look like so that you know what you're dealing with. I do ask if they have any history of diagnosed eating disorders or any history of working with a therapist in the past. That might open some areas for questioning as well.
So really tying the pieces together of what emotions are going on when you are eating these certain foods or at this certain time, that really would open the book a little bit for us to get a peek inside and see what's going on if there is an emotional piece to it. And then absolutely referral to a mental health counselor would be very important. So I know you touched on this a little bit in the beginning, and I think I know the answer, but now, should patients be following a keto diet or intermittent fasting or paleo diet?
Absolutely not. So there are a few really small, I'm talking 12 patients studies on PCOS and keto. And in these studies, over half of the participants dropped out by 6 months. So big red flag to me that this is not sustainable. This is not something, unless you choose to be following it and are dedicated, this is not something that's sustainable because it's very different from the way most people normally eat, right? Additionally, if we go too low carb, that's going to add stress to the body, which can increase adrenal stress hormones, which can worsen PCOS symptoms. It's also super hard to meet fiber and nutrient needs on a really strict keto diet. In patients who are trying to conceive, we really need to focus on nutrients. So that's not a smart approach. Plus, as I mentioned before, all those studies that have shown benefits with a low carb diet in PCOS, that's a 40% carb. It's not 5% carb. So we don't need to go that low to see the benefits of a lower carb diet. Intermittent fasting studies have mostly been done in men and menopausal women. It seems like it might be a smart strategy because it can potentially help lower insulin, but it raises those adrenal stress hormones, which can worsen PCOS symptoms. Additionally, research-wise, study after study comes out, it is no better than a calorie-restricted diet when it comes to weight loss. Most of my clients come to me already skipping breakfast. So if an intermittent fasting approach were going to work for PCOS, it would have worked already. I also really don't like it because it has us eating according to this external set of rules. You eat during these hours and not these hours. And that can have an even further detrimental effect on our relationship with food and trusting our bodies, which we've already said people with PCOS are more prone to disordered eating. So not a helpful approach. I don't recommend keto ever. And I don't recommend intermittent fasting in reproductive age women. It may be a more useful strategy in menopause, but I have so many caveats. It's like you can't be overweight. Your thyroid hormones have to be perfect. You have to have no stress, adequate sleep, not over exercising or under eating. So basically nobody. And you asked me about paleo. I think the upsides of paleo is it's a whole foods based approach, right? There's actually no research on the benefits of eliminating the foods that paleo eliminates for PCOS. We want to be including whole grains, especially the low glycemic ones. There actually are some studies on the benefits of beans, legumes in PCOS where there was one study where they added 1 serving of beans at lunch and dinner, and everybody in the study lost weight, improved all their metabolic markers, lost waist circumference. So I don't see the benefit of removing beans from the diet.
Thank you so much for breaking down the science too. I love that you brought us in some research and you backed your guidelines with what the literature says, because that's so useful for us. Those of us who don't have the time to sit over and pour over all the literature on PCOS. Would you like to leave us with any final thoughts? Did we mention kind of the key points that clinicians should know about PCOS and discussing nutrition with their patients, or is there anything else that you would like to add?
Just that it's not just nutrition. I talk about nutrition and lifestyle, and by lifestyle, I'm talking about sleep, stress, movement, and environment. So environmental toxin exposure, these are all things that I'm discussing with my patients as a comprehensive approach to care, along with the medications that their doctors may be prescribing, any relevant supplements that might be right for their situation. You really have to treat the person and not the condition, because every case of PCOS is different.
It's never a one size fits all regarding nutrition and fertility management and hormone balance. So I'm so grateful for you for coming on with us. And I thank you so much for giving us the gift of your time. We can't give this time back to you, but I know my listeners have gleaned so much information from you. So thank you so much, Melissa.
Thank you so much.
If you want to connect with Melissa, you can find her and follow her at Instagram at the Hormone Dietitian. We're going to go ahead and link below her book called A Balanced Approach to PCOS for any of you who would like to dig a little deeper into nutrition and lifestyle management with PCOS. Before we move on to my nutrition notes segment, I wanted to let you know that we have partnered with Patricia Skolnick Nutrition for all things gut health. Patricia is a registered dietitian specializing in GI disorders, and she's currently accepting new clients. Refer your patients to her website at www.patriciaskolnicknutrition.com. If you use code ExamRoomNutrition at checkout, you'll get 10% off any of her products available. You can also join Patricia virtually on August 24th for the Banish Your Bloat Masterclass, where you'll hear all about how to live bloat-free based on what is happening within your gut. And if you're looking for a more comprehensive answer to improving your GI symptoms, the Digestive Health Back to Basics program is open for enrollment. This is a 6-week hybrid virtual group program to get you started on your digestive health journey. This program has limited spots and gets started the week of September 4th. Don't forget to use code ExamRoomNutrition at checkout to receive 10% off all of her programs. All right, guys, now it's time for my nutrition notes. In this section, I like to share an interesting quote, a nutrition tip, or an interesting case that might add value to your day. So today I want to share a nutrition tip, and it goes really well with the conversation we just had with Melissa regarding nutrition and PCOS management. So when we're discussing weight with an overweight or obese patient, whether they have PCOS or not, you need to remember that weight is a symptom. It's not the only problem. So I like to think of it like this. Weight is the symptom of poor eating and lack of physical activity. So we should be focusing on the poor food choices and the lack of physical exercise, not necessarily the weight. Because as Melissa had just explained, weight is just a product of overeating and under-exercising. So if we can focus on those healthy behaviors, the weight will naturally resolve itself. Well, thank you so much for joining me, guys. If you have a question that you would like our dietitians to tackle, go ahead and send me a message at Instagram at ExamRoomNutrition, or send me an email at examroomnutrition@gmail.com. That's all for now. So remember, let's continue to make our patients healthier, one exam room at a time.